Me.
Hi, Indra.
Hi, well, I want to introduce everyone. I want to introduce Dr. King, Lori King. She is the owner and director of Turnaround Aesthetic Center in Texas, and she is with her team, Samantha and Amy. We don't see Samantha back there. She's our camera person, but we see Amy. Thank you, Dr. King, for joining us on SmoothGlo Live. We're going to do a patient demo today. So can you introduce your patient to us?
Hi, I'm Connie Coleman.
Hi, Connie. Nice to meet you. And have you had this treatment before?
I've had one treatment.
Okay, and how did you
About
feel
a
with the
month ago.
SmoothGlo? About a month ago. That's
I
perfect.
love SmoothGlo.
Well, how did it make you feel?
Actually, it's made me feel great, and I've had quite a few compliments on my skin since having it. My pores are smaller. I don't remember what it's called, but I have redness on my skin sometimes, and that seems to have diminished some already. My makeup goes on a little bit smoother. I wasn't really expecting that, so that was a nice little bonus.
You know, it's incredible, those little things that you notice. I love that you feel that the makeup is going on smoother and that people are complimenting you. That's wonderful. That redness, do you feel it's rosacea? Did you hear that before? You said you had a little redness to your skin.
Yeah. Sandra, we're having a hard time hearing you.
I am so sorry. Let me turn it up. So let me know if that works a little better.
A little bit better, yeah. You're coming across a little garbage.
Oh, it's the internet.
It's the internet.
Good old internet.
Yeah.
Yes, and I'll turn everything off in the background. So Dr. King, can you explain to me what you're going to do with your patient, and let's get started. Let's start with your treatment, your SmoothGlo treatment. And we're having a little bit of a frozen screen, so I'll just review.
Yes.
That's better.
Yeah.
Okay.
Is that a little better?
Ask the question again.
I was going to say, why don't we get started with the SmoothGlo treatment, and I can talk people through if they're feeling like it's a little garbled. So you can go ahead and prep your patient. The first thing you're going to do is the IPL treatment.
Yes.
And Dr. King, I see that you're delegating this treatment to Amy. And is that normally what you do in your practice?
Yes, Sandra, I'm glad you asked that because I did want to point that out. Of course, Amy and Samantha, already we have had the Lumenis in the Legend Pro for over a year, and they already have been kind of experts in those individual treatments. And so with Lumenis's excellent training and on the protocol, we all learned it together, and I feel very, very, very comfortable that if you have competent estheticians like I do, who are masters, I feel very, very comfortable delegating this procedure. Here in our office, I'm always around, and I'm almost always involved in the treatment of all patients. But yes, if you have competent.
That's wonderful, Dr. King. You are the first certified SmoothGlo provider in the state of Texas. I'm so proud of you for getting this started. You look beautiful in your pink. What made you feel like you needed to provide this treatment to your patients? I've looked at your website. You are really strong in health and wellness and in women's care. What made you want to bring SmoothGlo on?
Yeah, good question. anytime before bringing any treatment on, I really, really, really strongly consider, is this going to help the actual needs of the actual patients that I see in my practice? And like you said, many of them are women, many of them are of about this age group, our age. And their most common concerns are usually multiple. They'll say, my goodness, I've noticed my skin is sagging or it's wrinkling or it's thinning. It doesn't have much color. The texture is not good. The tone is not good. I have redness. I have brown. So usually they've got all of those concerns all at one time. And so I was looking for a treatment that we could treat the most concerns in the least amount of time, the most effectively, and give them visible results. And SmoothGlo absolutely does that.
Awesome, awesome. Amy, I'll let you tell us what you're doing next. I don't want to interrupt your flow. So you go ahead, and then I have so many questions.
Yes, so I just applied a light ultrasound gel on half her face that we're going to start on. And it's just, you know, to create a barrier between the light and her skin. But I love this treatment because it really helps with vascular and pigment. The M22 is one of my favorite machines that we use. So I'm so excited about this procedure because we're using this and the Legend Pro. So,
you know, the M22 was one of the first devices I used too, and I fell in love with it. And I'm just like, I feel like I've grown up with it because there's been so many generations, and it just keeps getting better. So this is, I'm with you on that one, Amy. So I'll let you take it from there.
So the nice thing about this machine is we preset it for SmoothGlo.
Nice.
So we can just go right to our settings, which I'll do right now.
Okay.
As it's loading. And so it will be preset for the patient. And then of course, as you know, if the patient can't tolerate the preset setting, we can always bump it down.
Absolutely.
Of course, you want your patient to be comfortable. Right, Connie?
So I'm like you. It's nice to make it easy. So presetting those settings, so you just have to go to one place, is nice. It's just convenient so you can move. How long does it take you to do this treatment when you're not on Instagram Live?
Probably a little over an hour, depending on the patient, you know, sensitivity. So
Okay.
It's not a very long procedure. So I tell patients just plan, you know, to block out at least an hour and a half of your time.
Okay.
You know, their sensitivity to things.
Okay. That's nice that you have a. Okay, so I'll let you start, and I'm glad you're just doing half of the face. Would you mind just doing treatment on the entire treatment on just half of her face so we can see the one side? Thank you.
Yeah, that'll be fine.
So Dr. King, you are in Southdale, Texas?
South Lake,
Texas, and your practice is Timuron Aesthetic Center. I notice you have a lot of specials. You have a spring special in May. You have one coming up in June. How do you advertise for the SmoothGlo, and are you getting a lot of reaction and a lot of patients wanting your treatment?
Yes, we really are. We recently just did a little video, kind of a lot like this, just demonstrating the procedure and talking about it. And we made it available through email to all of our patients. And we're getting phone calls. We got one 5 minutes before we started this. We're getting phone calls right and left. And of course, our shirts. And, yeah, and word of mouth. People are, when people get this treatment and they go out, people start to notice, what have you done with your skin? And they ask, and then, you know, so that word of mouth is spreading also, because it really is visible results.
Yes.
Well, you know, you guys, I can talk on and on about this, but I do want to watch you do this, Amy.
Okay. So we do wear protective eyewear. If you haven't noticed, our cool glasses.
I love it.
Okay. Just gonna start kind of down below her jawline and kind of work my way up.
Okay.
Funny.
And usually that bright light it can kind of startle people. I notice your patient is doing extremely well. Looks
She
very
is. She's a
comfortable.
pro.
Yes, she looks great. So IPL and while Amy is doing this treatment, IPL is always the first step in the SmoothGlo protocol. So we start with IPL. It's a 560 wavelength. We're doing about 20 joules per centimeter square, and we have a double pulse going. It's really comfortable. We're covering the entire face, but for this purpose, we're only going to do half because we really want to see what it looks like before and previously and before. We want to compare because honestly, you can use a little bit of sunscreen and go out and nobody will know. You just have a little bit of a glow afterwards. So it's wonderful.
Yeah.
Dr. King, why don't I ask you, while Amy's finishing, what if I walked in your door wanting the SmoothGlo protocol? How would you counsel me or consult me?
Sandra, yeah, that's an excellent question, Sandra. I would be very excited that you came in and that you had heard about SmoothGlo. And just knowing your particular skin type, I would absolutely counsel you that we can still do the radiofrequency voluderm microneedling treatment on you and have amazing results. We can do that on any skin type. And so absolutely there's so much that we have to offer for every single skin type.
So you don't have to turn anybody away, which is wonderful.
Right. Previously we would have to say, well, we can't really help you too much. Of course, we would not be comfortable doing the IPL probably, but the radiofrequency microneedling part of it still gives almost all those exact same benefits.
Yeah.
Great, great. Amy, are you done already?
Yes.
Okay, that was wonderful. You're a pro. So now what do you do?
So normally, of course, I'll clean the patient off, take the gel off, and then I'll get the Legend Pro ready and then do the needling treatment. So
Okay. Well, we have a question, Dr. King. Maybe that you can ask your patient. How did this feel during the process?
Yeah.
How did it feel?
So if you saw me do that at all, it's really the light and the click that makes you jump a little bit. It doesn't hurt at all. It's the light and just the click. It feels like a momentary, how to describe it to you? Momentary zap. It's not even a zap, just a ding, like a moment. Which, like, faster than that. And that's really it. And Amy is, like, really good at saying, are you okay? Are you okay? And then I have always told her the last time that just because I jump doesn't mean anything. If I hurt, you'll hear me. But it truly doesn't at all. It's just your reflex with the light.
Well, thank you. I just want to tell our audience, my name is Sandra Woods. We're coming to you live at Dr. King's office in Texas, Timuron Aesthetic Center. We are doing the SmoothGlo SmoothGlo protocol, and it involves the M22 IPL and our Legend Pro microneedling process. It's a synergy of two devices, two experiences. We usually provide this protocol. It's one treatment every 4 weeks. Every time I talk to our customers and our patients about this treatment, they are saying they see something, a glow, a change in texture after the very first treatment. Someone asked me earlier, do you have this in Georgia? I would please call 1-877-Lumenis, ask to get the number of the representative in your area. For your area, Dr. King, it's Ross Durant is the regional manager. He's incredible. He has really spread the word about SmoothGlo. So there's an advantage to being the first one on the block, isn't there?
yes.
Yes.
Well, and like she said, we've been getting a lot of calls, just asking questions, and there's a lot of hype about it. So I'm excited because we've seen great results, just the patients that have done the treatment.
Yeah.
It's been amazing. So
Great.
even just one treatment, they see great results. But of course, we recommend, you know,
The
4.
full series of 4. Is this an expensive treatment, or can you give us a price range?
For the face, we charge $675, and typically it can be it's more cost effective that way because we're combining the 2 treatments. But we love it. So
Yeah.
Okay, I think that's wonderful. Okay, so what are we doing next? And I noticed you took the gel off.
yes, so she's all clean and sterile, and so we'll be using the Legend Pro RF microneedling next. And I love this because it really does help with texture, just everything, wrinkles, any skin issue you may have.
Great.
Yeah.
Now, did you use any topical anesthetic for this procedure today?
We did, but just very little,
Okay.
just for the patient's comfort level. So.
Okay.
You really don't necessarily need it. I myself have had it done
Yeah.
with no anesthesia, and a lot of patients are comfortable with doing that, and very, very, very comfortable.
Good.
Yeah, even just ice. I always tell patients, because they hear micro needling, and it seems like the needle part of that word is what jumps out to them. So I always
Right.
tell them, I really want to emphasize the micro, because needles really are so tiny, they just barely even prick the skin, and it's the energy that does all the improvement. The energy
Right.
that gives you all
Right.
the benefit, and it goes down into the dermis. And
Well, I know that
tightens and
the
thickens.
microneedling is virtually painless because of the grounding plate and the needles being so close together. There's really no arcing. It's a smooth, it's almost like a knife going through butter. It actually heats the skin up before the needles penetrate, allowing that smooth transition into the skin. And so that's what's really nice about the Legend versus other microneedling devices, that there's a mechanical force of the needles through the skin, and that's what causes the pain. So it's nice that you tailor your whatever you're doing, your treatments, to your patient's desires. Like if they need a little topical numbing, you give it to them. But you said for yourself, you don't use it. That's great.
Right. Another thing I love about this treatment is it's bloodless. So we don't have blood, we don't have plume that we need to worry about. It's a very clean procedure. The patient doesn't leave bloody or anything like that. It's
Nice. Very nice.
yeah.
So now we're using the microneedles. Are you using the 36 or the 36L?
The 36.
Okay, wonderful. So what we are trying to do is actually provide heat a little deeper down. So this part of the procedure is better for texture. Right. And the IPL, where the IPL was better for actually the discolorate, a little discoloration, any of the skin changes that we might get from photo aging.
Yes.
Very nice.
I love just how the texture of the skin is after their skin does heal, like about a week later, just how smooth it really does look. So the name fits it perfectly.
SmoothGlo, exactly. I like that.
Yeah. I've also noticed in some of my patients who've come in after their second or third treatment, the pigment, the coloration of the skin, it almost looks like their skin is thicker, and it almost looks like they're wearing foundation, even if they're not. It's just that normal, healthy glow.
That's nice.
That really you can't get with any other treatment that I've seen. And that was kind of an unexpected benefit, as I'm looking at people thinking, wow, it looks like you're wearing makeup.
Right. Somebody is asking, how is this compared to the Morpheus 8? And I want to start this conversation, and then I'll let you chime in if you'd like to add. But other microneedling devices become quite painful because of the arcing involved. And I personally, as a physician assistant, I've owned other devices, microneedling devices, that I've really had to use not only topical numbing, but facial blocks just to get the patient comfortable enough for the treatment. So I really would suggest that you look at the Legend Pro. It was a game changer for me. I was very nervous about any more microneedling after I used that previous device. And now I just, first of all, I couldn't believe that on my skin, I just loved it. And I am a solid skin type 6, and I just had wonderful results. And I would love to come down not only to get one of your pink shirts, but I'd love Amy to treat me. And she just seems like she knows what she's doing. But I just like that it can be for all skin types.
Me too.
Yeah.
And it's great because, you know, you have a lot of people that are a darker skin type, and a lot of times there's scarring and things involved, and this machine is great for that. So.
Okay, so people that might have a little acne scarring involved with post-acne treatments. So, I mean, I see that you provide so much care, and I know, Dr. King, sometimes when you place people on hormone replacement, they might have a little bit of acne. So this is nice to provide afterwards. Very nice.
Yes, it's great for any scarring.
So the question is, what are the skin issues that this treatment are ideal for? And would you like to start, Dr. King, and then I can finish? What do you like when somebody comes in? When do you get excited about, oh, she's a perfect or he's a perfect SmoothGlo patient?
Yeah. For me, the game changer with SmoothGlo is definitely the tightening of the skin. It's excellent, and really the best thing we have, almost the only thing we have to simultaneously tighten and lift the skin, as well as treat the wrinkles and the pores and the reds and the browns and scarring, kind of all at the same time. But someone who's maybe 20s, 30s, and doesn't have as much sagging, I think they might not see as much benefit because they're already a tight skin as someone who's a little bit older, a little bit more mature skin, maybe a little bit more sun damaged. The wrinkles around the mouth, the wrinkles kind of out here on the cheeks really just kind of perk up. The jowls kind of perk up. And so that excites me when I can tell them I can help you and we can help all of those conditions.
So thank you so much, Dr. King. So first of all, my name is Sandra Woods. I am the Director of Clinical for Lumenis. We are doing the SmoothGlo procedure. It is a combination, a synergy of using M22 IPL with the Legend Pro microneedling together. And we use the IPL, we always do our IPL first, followed by the microneedling, and it's called SmoothGlo. To find out if it's in your area, please, it's 1877 Lumenis, and ask them for the nearest SmoothGlo provider, or you can ask them to speak to the Lumenis rep if you are a customer interested in buying the IPL and the Legend or seeing this. We have a laser elevation program going on in San Diego in June. You can also look us up and see if you'd like to attend this in order to get more information about our SmoothGlo. But, you know, just reaching out, Ross Durant in Texas, reaching out to him, he will make sure he takes care of you if you're in the Texas area.
Yeah. And I would love to speak to any providers, especially if you already own the wonderful Stellar M22 and the Legend Pro. If you already own both of them, it's really a no-brainer. I know you're using them, and individually these devices do have you just have outrageous great results. But if you have both, and you do put these together, these combinations sequentially together.
Wonderful. So I have a feeling, Amy, you are done. And can we take a peek at your patient? She's smiling.
I'll set her up for you guys.
Okay. And if we can just get a close up, and she just looks just a little pink. How do you feel?
Feel great. I mean, that part you don't really even jerk. Like I said, the first part, it's really the light. It's the natural. You have a light that just makes you, you know, if you jerk at all. That part, I didn't hardly feel at all.
So what is your downtime? When do you feel like, or do you feel like if you went out tomorrow, somebody would notice that you've had something done?
On my last treatment, because was a month ago, I had no downtime. I had it done really about the same time. And to go home, you follow the protocol with the regimen for the skincare that night as to what to use and what not to use. And I think I was out the next night because I think I had it done on a Thursday as well. Yeah. So I was out wearing, you know, my makeup and just looking beautiful the next night. Not so much like right now.
And but you will look beautiful tomorrow night. And you know, thank you so much for helping us and really giving us a good understanding of how it feels to be on the other side of SmoothGlo. And it seems like it's so easy for you. It's like you just seem very happy, and knowing that in a couple days people are going to compliment you again. And so you're 2 treatments in. And would you mind if we call and see how you're doing after the 4th one?
Oh, not at all. And I want to really emphasize that this is very painless, and the benefit is really just, it's remarkable. I mean, people commented on my skin a week later.
That's wonderful. I would love to peek in and look at your before and afters. Maybe, Dr. King, can we, if your patient allows, can we post your before and after pictures? And I would love that. I would love that. Well, thank you, everyone.
Yes, thank you,
everybody
guys.
is saying how great you look. So,
My husband.
yes, I'm excited for you. So you'll be ready for Memorial Day. Amy, thank you so much.
Thank you. Yes, thank you.
And Dr. King, thank you for letting us into your practice. I'm always learning something new. It's so great. You know, back in the day, I used to have to fly around. Now we get to visit you via Instagram and do these fun programs. And it's really nice to that you're a part of the team.
Well, thank you. I am so happy to be part of this team. It's fabulous. It's a fabulous company, and I just appreciate everything.
Okay. Yeah. You're welcome. Ladies, take care.
Thank you.
Keep it going. Keep it going.
Thank you all for joining us.
Yeah,
Okay.
thank you.
You're welcome. Bye, everyone.
Bye-bye.